What we heard was that we have a lot of amazing women that are working in all different regions of our state, doing some serious heart and head work. And so because we had as many people as we did, which is glorious. I love that our conversations, we learned that we're going to modify this so we can get to more of the discussion next time. And so I just want to say thank you for all the work that you do, everyone that was in session 1. My heart was touched because I know how many other women that cascades to. So thank you. Session 2, I think that was it? Who's session 2?
Me, Sherry.
Thank you, Sherry.
So I'm Sherry, and we had session 2 as well. Just amazing group. Their introductions it was really nice to learn what they're doing out in the communities and how they're servicing everyone. There were several that were new to 4th trimester. This was their first meeting, so that was really exciting that we've got more people on board to support the efforts. I think telehealth was really a big thing that they were saying was very helpful to everyone. For example, someone was from Yavapai County, so the rural communities, they really don't have the services that we can provide. So even connecting them with telehealth services in Gilbert is a huge thing. And just getting into the doctor and trying to find services was really hard for them as well. And I think that we can see that here in our metro urban areas as well. And just having parents or moms that feel guilty about having those feelings of postpartum and grieving the losses was a thing. And then altered situations on birthing experiences. Again, those limited resources, limited support in the pandemic was really hard. So I think that even though, as we've talked about today, just being virtual has actually been a good thing that has come out of the pandemic for our group.
Thank you so much, Sherry, for sharing that. I really appreciate that. Yeah, it's nice that we've been able to find a silver lining. Yeah. Okay. And then our next rooms, I'm going to go ahead and share.
Sure. So I'm Ryan. I was the moderator for Breakout Room 3, and we had a diverse group with lots of providers and parents and multiple new parents, so or at least new babies. So that was wonderful. I think we heard a lot of the echoes of the things that the other groups talked about, but one of the things that was acknowledged in our group was that a lot of these challenges existed before the pandemic, and so while it may have exacerbated them, it may have also shed a spotlight on them, which is perhaps one of the silver linings, and also forced us to be creative in terms of how we address it. So, but one of the challenges is also that, I think these discussions are, my dog. So sorry. These discussions are revealing how many resources there are out there and people working on these issues. And it's just, there's not really a centralized hub of information yet. There have been some attempts, but, wouldn't it be great if we could all be aware of these resources, both providers and birthing people and the people that support them. So I think this group is part of that work.
Thanks, Ryan. Wonderful.
Sorry about the dog.
No worries. We have dogs here too. And Eileen, if you wanted to share out as well.
So room 4, again, amazing people, great introduction time. So we talked about gaps and what gaps we feel there are in services. And it ran the gamut of stigma, insurance, language, financial security or insecurity, and the fact that we are talking about it and that we are bringing things to light and how we can continue to advocate for it.
Awesome. Thank you all so much. Yeah, it was wonderful discussion today. I really appreciated that. As our time comes to a close, we'd like to share a few opportunities for you to continue making an even greater collective impact. We do have another lunchtime conversation coming up in August. It will be focused on the impact of COVID-19 on infant feeding. So that will be August 6th. And also in September, on September 24th, we will have our 4th trimester ecosystem summit. That's going to be a full day of stuff just like this, talking about how COVID-19 has impacted maternal and infant health, and also just what the state of that is for us here in Arizona. So we'd love to have you join us. Stay tuned for more information on the ecosystem. We're working on getting that website up so that you'll have the ability to register. And thank you so much all for being here and participating with us today. I know that these conversations are so much more rich to have all these different perspectives and people from all over Arizona. We can't thank you enough for taking the time out of your day to do this. And we will be sending you a copy of this recording, as well as the slides and the notes from our breakout sessions. So we'll see you on August 6th for our next lunchtime conversation focused on the impact of COVID-19 on infant feeding. And please feel free to invite a friend or colleague. Thanks so much. There you go. Thanks for taking us. Oh, Megan, you can take us off live too. I'll wave bye to the people on live. Bye, Facebook.